Welcome back to another video. You want to start a garage gym therapy practice, but you are wondering what it looks like to actually work with clients. And I know this is something that was really important to me when I first got started with my own practice, was just being able to visualize what does it look like. And in this video, I want to share with you some of the similarities and differences of working with clients in your private practice in your garage gym versus potentially other settings that you might have worked in, as well as what the sessions might look like. And if you do have any questions about it, leave those questions down below in the comments and I will be happy to answer them. And keep in mind, if you are somebody and you are wanting to start or grow your own successful solo practice as a therapist, we do have openings for coaching clients in our DPT to CEO program. So if you are looking for a step-by-step checklist and outline and roadmap of how to start and grow your own solo practice and start working with a full-time caseload on your own, you can check out the link down in the description below to apply for the program and set up a call with me, and we can talk about it and what you want to do and your goals to see if the program would be a good fit for what you're looking for. So with that, let's get into more information on how to work with clients in your garage gym. So I wanted to talk about some of the similarities and differences of working with clients in your garage gym compared to other settings that you might have been in. So for me, I have experience working in outpatient ortho. I did work in a skilled nursing facility on one of my rotations. I've also worked in home health. I've worked in another cash practice before. So I've done a little bit in a few different settings before I started my own practice. And then within my own practice, I've worked with clients in my garage gym as mobile clients in their own garage gyms. I've worked out of CrossFit gyms, and I have also worked with clients online, so through telehealth and everything. So that's kind of my background and my experience and what we'll be comparing it to. So similarities of working with clients in your garage gym compared to say outpatient ortho, like a general traditional therapy setting. So with working with clients in your garage gym, keep in mind what I would suggest doing. If you are providing therapy services, you are still going to do a regular evaluation and regular follow-up session. One of the differences with that is that your evaluation can take as long as you need it to. For me, I know I kind of like to schedule them for about 75 minutes or so. Sometimes they're a little bit shorter, sometimes they're a little bit longer, but in particular for the barbell athletes that I work with, it's important to me to be able to provide us enough time to do kind of like your general ortho evaluation with plenty of time to talk through the subjective and past medical history, as well as having time towards the end of the session to do a lot of movement assessment with the barbell and figure out, with where they're at right now and what they want to do with their sport and with exercise and everything, seeing what information we can gather from a movement assessment, which I know for me, I didn't always really have time to do in regular outpatient. So I like to schedule enough time to do that. And the cool thing about it is that you have the freedom to figure out what you want to include in your evaluation. And along with that, your follow-up plan can look like whatever you want it to look like. So it doesn't have to be them coming to see you 3 times a week, unless that's what you and the patient determine is going to help you best get the results and the goals that you're looking for. But generally, I see people probably every week or every other week, once a week. And then from there, we will schedule to every 3 weeks, every 4 weeks, a little bit further out, just depending on what they have going on. Some similarities, some differences with that, but you're in control. You and your patient get to decide. You are still in a garage gym. You're still going to be able to do exercise, therapy interventions, manual therapy interventions. I have a plinth, a foldable table that I will use. I also got a foldable table that's just on the floor for body tempering. So that's something that I've done a little bit more of as far as manual or instrument assisted manual therapy goes. And having the floor table is kind of nice too, to be able to get down, good body mechanics and everything. So So having a couple of tables is nice, but also it's kind of been my experience that the typical like gym goer and CrossFit athlete is not shy about just getting on the ground too. So that's totally fine if, like that's how you can best work with people. But you'll still be able to do those interventions. If you do any other kinds of modalities, you can still do that. You'll just have as much time as you need to do those interventions. And overall, like working from your garage gym is going to be pretty similar to working out of any other kind of gym. One of the main differences is that it's typically only going to be you and the client. Maybe if the client brings somebody to be there with them or if they bring their kids, but that is kind of it. So, like, a really nice part about it is the privacy. While the garage door is going to be open and you might have like people or cars passing by, you don't have to try to like raise your voice over the atmospheric noise of the gym going on, which I know is something that I've had trouble with in the past working out of a bigger gym. Sometimes it's just really loud and it's hard to have a conversation with my client. But working in a garage gym, everything is much quieter and low key, which I think is really nice. And getting into that a little bit more, like some of the major differences to working out of a garage gym versus working out of a bigger gym or an outpatient is it is going to be totally private. So you don't have to worry about anybody overhearing your conversations. The atmosphere is going to be much more relaxed than having a bunch of people around. So that's one of the reasons I really like it too. It is completely one-on-one. Again, nobody's around, but depending on the size of your garage, you might even be able to do small groups if that's something that you're interested in, whether it is like group therapy or group personal training sessions. With the size of the garage that I have, I could probably work with 2 people at a time if I wanted to. So if that's something that your practice or your business is planning to do, that's doable. This is this is something if you live somewhere where the temperatures can get kind of extreme. So like I live in Las Vegas, it gets a little bit hot here. Working out of a garage gym, it may or may not be climate controlled and you might have a lot of sun. And depending on yourself and your patient population, it may or may not be appropriate to see clients in the garage gym. So I know for me, if I were working with a much older patient or really anybody who's sensitive to the heat, it might not make sense or might not be a good idea to work with that patient in a garage gym that does not have air conditioning, no fans or anything, and the sun is just shining like right in. It gets very hot and uncomfortable. But again, depending on you and who your client is, you guys might not care and it might be fine and you just deal with it because it's kind of just part of the whole like garage gym experience and environment anyways. So always make sure check with your patient, check the weather forecast and make sure that it does make sense and that nobody is at risk of anything. We did install a mini split in the garage, which has been really helpful, and it does heat and cool air so we can shut the garage door and then keep it kind of comfortable in there. I do have a fan in there as well, and we had a swamp cooler for a while. That was good, but like in the summer, like it probably is just going to be hot, and making sure that your client brings water or that you have water available to them is going to be important too. And then if you are working with clients out of your garage gym, I would just make sure that you like double check with your liability insurance and with your homeowner's insurance to see like if there's anything special that you need to do. You can just call them and tell them this is what I'm planning on doing. Do I need to do anything differently? Or do you need anything from me in order to like make sure everything is good to go? Everybody's insurance is going to be different, so just something to look into with that. Next thing I wanted to go over is what to remember and kind of like pro tips, I guess, for working out of your garage gym clinic. Number one, make sure that your clients always know where to park. So whether you have a parking lot, I have street parking, whether they can park in your driveway, tell them, like text them or on the phone when you're talking to them, tell them where to park so that it's not difficult to get to you. And also let them know where to meet you. So for me, I just leave the garage door open and I'm in the garage and I just tell them you can meet me in the garage when you get to my house. house, I'll be in there. But if your garage is like detached from your home, or you have like a separate entrance to get into the garage, make sure the client knows where to go or things are clearly labeled. That would be helpful. Like I said, have water available. So we have a water cooler in the garage. My clients can always like fill up their water bottle, or I can get them a glass or whatever, so that they have access to water. We do have a bathroom that's right inside the garage door. I have had people go in there a lot, like obviously to go to the bathroom or to get changed, like if they come from right after work. So make sure that you know how, I guess, like how to tell your clients to get to the bathroom, where the closest bathroom is in your house. And I know for me, one thing that I try to do too with my dog, because not everybody is a dog person, is I'll put up like the fence around like the hallway near the bathroom and the garage door, so that my dog can't get through if my client does need to use the restroom. Make sure to have cleaning supplies so you can wipe down your tables, your equipment. I have to sweep out my garage, so you'll want to do that, and just making sure everything looks presentable. I have a whiteboard, which is helpful to be able to write down the workouts or the exercises on, or draw diagrams. I try to keep the like more garage storage stuff as organized as I can, and keep it like limited to one corner of the garage so that it's not, spread out all over the place. It does look nicer with painted walls. When I first started, we did not have painted walls. And I'm sure if you look, you can find like some old photos of my garage gym. It doesn't look amazing, but it worked. It did not stop people from working with me or paying me to work with me in my garage gym, but it does look nicer. So if you can paint the walls of the garage gym, that would probably be helpful. And I also think it's good to have a sign. So I think I have 3 signs now in my garage. One says Morgan and Kyle's gym, one says the Well Physio, and then I also just have a banner that I made for a recent event that has like my business information on it, along with the services that we offer and photos and everything. So the signage, I think, helps to add like some credibility, some trust that it's a legitimate business and everything, and to help promote you. So those are a lot of things to remember. And if you have any pro tips or other things, please leave those in the comments. I'd love to hear if you are currently operating a garage gym clinic, how that's going and what kinds of things you do. And then lastly, just parts of the session. I think I kind of already covered this, but usually it always starts off with an evaluation, the initial assessment, and we go through the subjective. Based on the subjective, we'll figure out what objective testing we might want to do. I always have my patients fill out their like intake form and medical history form prior to the appointment, so that I have time to look through it and take notes and figure out what kinds of questions I want to ask. And that also helps me determine what kind of testing I want to do, so that I can go into the session prepared and I don't have to try to figure it out once the patient is already there. When I worked in regular outpatient, that was something that always stressed me out so much, was not being able to prepare for the evaluation sessions. And I know like you can still pull it off, but I would rather go into it being fully prepared and being able to bring any extra information that the client might want or might be helpful for them. That's my recommendation and how I do things. But same kind of objective testing available to you: range of motion, strength, palpation. And then, like I said, you can get into movement analysis. It's nice being able to have like all of the space in the garage gym, so you're not like between other patients or like around a bunch of like equipment that could get in the way, and like compared to a regular clinic, but you have all the space that you need to do different movement analysis. I always like to test things that like they are, reporting are painful movements or things that they've had trouble with in the past, looking at different things to assess their mobility, all kinds of things. So like also just like body weight movements versus barbell movements. And then all of our follow-up sessions are pretty similar. The way that I structure things is there's always like a subjective section during the session where we go over how the past week or two have been going, how they've done with their exercises, what questions they have. And then we get into exercise therapy portion of the session. Usually this starts off with, we do a bunch of education, starting with some more like foundational exercises. And then as their plan of care progresses, that part of the session will transition to being kind of like a warm up and then a workout. Eventually, like we end up doing like workouts that are specific to whatever symptoms or problems the client has been having and why they're at physical therapy. And that's how I like to retest their ability to do different things. And then at the end, we might do some manual therapy potentially, or we just kind of go over how the session went and what our plan is for the upcoming week or two or the next month if I'm not seeing them for a little while. So that's kind of the structure of everything. And like overall with this video and just explaining how I do things and hopefully like being able to see what it looks like a little bit has helped to give you the visual that you need to figure out if this is something that you want to try. And you need to know like you can still deliver really great care working out of a garage instead of being at a clinic or having like all of the equipment you could possibly want. It doesn't have to be super complicated, and you can still have a really good impact on your community and on your clients overall. Last couple things. Oh, one thing that I didn't mention is make sure that whatever you are doing clinically, of course, like it's okay to do in a garage space where the door is open. So like for example, I have been working the past couple of years obviously like with mainly like fitness athletes, but I also have a special interest in pelvic health. And the way that I treat people who have pelvic health problems is a lot of education and exercise. I don't do any internal pelvic health stuff. I personally would not feel comfortable doing that in a garage. If I were to provide internal pelvic health services, probably would not do it in a garage. That might be something that would be a little bit better to do as a mobile practice. So like visiting the client in their home potentially. But I personally don't like the idea of doing any kind of internal stuff in a garage, but to each their own. But like seeing mostly like ortho and sports type diagnoses, or like I said, like all pelvic health stuff that can be addressed with education and exercise, totally okay in a garage gym. So anyway, I hope that this helps and gives you some more information. Whatever questions you have, leave them down in the comments, and I will plan to see you on the next video.